Yeah. Honorable Ministers, members of the SADC private sector and our partners, the SADC Secretariat, my own boss, UNA's Deputy Executive Director, Dr. Luis Lores. Good evening. I'm pleased to welcome you to this very cozy affair. Cozy enough because it's really not a formal thing. It's we are reporting on progress that we have been able to make in the very mandate that we are given by the SADC, our SADC Ministers of Health. As the special envoy, I like that title. My name is Professor Sheila Clow, a former Minister of Health of Botswana, UNA's Regional Director for Eastern and Southern Africa, but most important, the SADC Special Envoy for the Ministers of Health to the private sector so that we can be able to work together and see how our region can really stand on its own when it comes to health and development issues. So I'm not going to take too long in the sense that I'm going to come back again. Now, we were given 4 mandates, but I think at this particular juncture, I need somebody who can be able to welcome you. And with that, I want to recognize the chair of the SADC Ministers of Health, Dr. Parire Nyatwa, but not yet to call him. The person who I want to call now is my own Wanamalume, Stephen Sianga, who is the director in the SADC, to come and give us really the introductory remarks and promise us that what we are doing will bear fruit. Thank you, Sir Sianga. So please welcome him.
Good evening, honorable ministers and distinguished guests. Honorable Minister, Chairperson of the SADC Ministers of Health and Ministers responsible for HIV and AIDS, Honorable Dr. David Parire Nyatwa, Honorable Ministers of Health here present, our own very special envoy and the convener of this initiative, Professor Sheila Clow, who is also the Regional Director for East and Southern Africa, UNAIDS, the Deputy Executive Director of the UNAIDS, distinguished representatives of our partners, the private sector, IOM, and indeed all other partners that we've been working with on this important initiative. Let me also recognize the distinguished senior officials and the heads of delegations at the level of senior officials from our member states, and also those from the national AIDS authorities. And indeed, my own colleagues from the SADC Secretariat here present. Chairperson, allow me firstly to convey sincere apologies from the Executive Secretary of SADC, who would have actually accepted your invitation. But then it coincided with yet another important assignment. The Chairperson of SADC, His Excellency President Mugabe, was in Gaborone at the SADC Secretariat yesterday and today. And therefore, it was not possible for the Executive Secretary to join you and to be with you on this important event. He therefore instructed me to stand in for her, and it is really an honor that I'm able to, on her behalf, able to welcome you. And also, as you recall, this meeting is a response, or it is an implementation of a decision that the ministers took at their last meeting in January in Victoria Falls, where they directed that a special session within the margins of WHA be convened to receive feedback on progress by the task force which was established to look at the issue of innovative financing for the health sector. We are therefore happy that with the support of our partners and the Special Envoy, we've been able to implement this important ministerial decision, and also, of course, with the support and guidance of the chair. We are aware that resources for the health sector, indeed for development in general, are dwindling and are scarce, and therefore there is need for innovative ways of mobilizing resources and also efficiency in their utilization and management. We fully, as SADC Secretariat, subscribe to the efforts by the private sector to contribute to the attainment of better health outcomes for our people. As part of the work or input in this initiative, we did a situation analysis on the state of sustainable financing for health and HIV in the SADC region. And I'm pleased to indicate that we have electronic copies of this report and the framework, and we would like to share with you this document or these reports. The analysis did examine the health and HIV financing gap and also opportunities for increasing the fiscal space for health for each of our member states. The analysis points to the fact that implementing efficiency savings in the health system, expanding the fiscal space for health by innovative sources, increased government contributions, and mobilizing additional resources could support efforts by the region to achieve universal health coverage. Thus, any actions for sustaining and improving the health status of the SADC citizens must be encouraged. On the basis of this situation analysis, our honorable ministers of health and those responsible for HIV and AIDS at their meeting in January in Vic Falls, Zimbabwe, did approve a SADC framework for sustainable financing. And the framework is very consistent with the efforts that are being pursued now, as it does promote innovation in financing health and HIV. The SADC Secretariat, we welcome this partnership, and we commit ourselves to supporting efforts by the private sector to the health initiatives and interventions, and therefore renders our support. Let me also again express our sincere appreciation to the SADC Special Envoy, Professor Sheila Crow, for convening and coordinating activities of the task force, and indeed also for enabling this event this evening to take place. We also would like to acknowledge the contributions of all the members of the task force and all the partners from the private sector who are here gathered, and we continue to look forward to the guidance and leadership by our ministers and other key stakeholders, both in the UN family and in the region. And we look forward to a fruitful evening and a dialogue. And once again, sincere apologies on behalf of the Executive Secretary. Thank you very much.
Thank you very much for that great introduction, my brother. I think it does set a stage just to really to say where we are and where we're going. So at this juncture, let me particularly thank the ministers for being flexible. That part I forgot, because this dinner it started as a lunch, then it became a breakfast, now it's a dinner. But they were able to be that flexible because in the ultimate is something that all of us want. So really, nobody may give you a hand, but I want to give you a hand because somebody else could easily have said, hey, what is this? But at least you all were aware that it's neither a dinner, nor a lunch, nor a breakfast. It's actually a meeting to come and really see where we are. It's actually looking at progress and where we're going. So it's really great. For that one, I want to also then welcome our dear Honorable Dr. David Parirenyato. You know, my own brother, we come a long way, and we have aged on working on HIV, TB, malaria, and NCDs. But my brother, there's a light at the end of the tunnel, and it's not an oncoming train. So come and welcome us. Thank you very much.
Yes, Professor Sheila Tlo, the convener of this meeting, who is also former Minister of Health, Botswana, but more importantly, our special envoy, whom we appointed to do this work that she's doing so well. Let me recognize the private sector here. Brian Brink, I know you're supposed to be leading this private sector, so let me recognize you. Honorable ministers that are here, very important people, ministers, I can see, and the deputy ministers, but the deputy director, UNH, it's good. I saw in the afternoon, you're going around lots of meetings.
You did the best today. There was a huge plan of adolescents, girls, and kids. And in general,
no, let me do the speech.
Wonderful. Was the best, the best message in the whole meeting was the meeting. So we are all very proud.
SADC Secretariat, Dr. Sianga and your team, but also IOM. You've been consistent. We are very pleased that you are here. So I think that this meeting, Sheila, it's an important meeting for us. You know that the post-2015, that monies are going to go to climate and environment globally. Climate change is really coming in a big way. So health will be that much shrunk. And health ministers in the SADC region are very, very together. And we said, no, let's see what can be done for HIV, for AIDS, and health in general. And we are so pleased that the special envoy has really been very eloquent at making these things happen. And she has gone even to what Brian calls the fourth bottom line, to make sure that the private sector does what they have always wanted to do, to be part of the health sector in a very positive and visible manner. So I'm looking forward to this meeting so that you go through the 4 points. I know that some people are saying, yes, want to eat, but it is a meeting, and I agree with you. We'll listen, we'll contribute, and I'm quite certain that after this meeting, there will be a way forward that's going to be sustainable for the health system in the SADC region. So with those few words, welcome you all, please participate, and let's question each other if this is the right thing or not. I'm sure it is, but let's strengthen that. Thank you.
All right. Thank you very much, Minister. Can the starters be served, please? I'm seeing it's mostly fish, but I guess those who are allergic to fish will have a choice. But while they're serving that, let me just start by saying that we are going to have some networking, but among us, we do have the private sector. And, you know, Brian Brink has already been introduced, but we also have the president of the GHD, Global Health and Diplomacy. These are going to be our facilitators because they are in this, and we'll be able to then, from here on, be able to work with them. But we have our marketing team from the Global Fund, the partner of all of us. Now, those are the biggies. So it's always nice to have them with you because they have been at this game for a long time. But I don't know, maybe Joanna should call you to introduce some of your people while the status is coming. But we have Ventura with the IOM, International Organization for Migration. As we are aware, we have porous borders. And we do have refugees, we do have migrants. And in fact, I guess all of us are in the ultimate migrants. We come from somewhere. So he is a very great global partner because when we are looking at collaboration within SADC, it has to include people who are either displaced or who have migrated somewhere. to ensure that those are taken into consideration. So Ventura, you are very much welcome. But most important, we have Discovery. Some of my favorite people. He's going to be reporting on something, so that's fine. I will not be able to mention him too much. But I'm hoping that during the networking, we'll be able to introduce, ourselves, because some of us are representing ministers, but some, like my friend here, my brother, Dr. Mugabe, he's with country support, so he'll be the one supporting all our countries in whatever else will be needed to ensure that we're in it. Apart from the SADC Secretariat, those ones that, they are your colleagues, they are your children, you know them, from Remedy Saizile to Doreen. These are the people that we will be working with, and I think very regularly. Going to Botswana has always been nice for me, even though I live in Johannesburg, but going to Botswana is a great pleasure, so we'll be going there quite often as they want. So, Joanne, you want to, or Chipo, you want to say something while the starters have been served? Yeah, Joanne, you're fine. Yeah, okay. Let me get Chipo. This is the scout worker. This is the one person who knows how to work 24/7. You know, if it was from my tribe, I would be saying she's a zombie, because we are able to wake up people from the dead and make them work. And she works that as hard. So she's really the spirit behind. She is able, when I say to her, Chipo, this has got to be done, it gets done like within a second. She's really somebody that we value a lot in our partnership with the private sector. And I think SADC, has gone to know that, yeah, we do have somebody that we are working with. Even just moving this, this meeting from being a breakfast to a lunch to a dinner, it was her. I came in yesterday, it was like, and I was jet lagging, and she said to me, no, you can't jet lag. We have a situation. So poor me had to go, when I thought I was going to sleep, I found myself at that conference center, now looking for our chairperson, the Honorable Paride, now to say, where is he? Let's sit down and see what can be done. And immediately we agreed. It was a question of just a few things, and here we are now. So it is really my pleasure to be able to get her to come here, finish off where I haven't been able to, especially when it comes to the private sector. Chibo, yeah, please give her a hand.
Thank you very much, Special Envoy, SADC Chairperson, and all ministers and all protocol reserve. I think it's been an exciting journey for us as the private sector, and I'm not really going to talk much about it because Brian Brink serves as our SADC chairperson of the private sector constituency, and he'd be able to share a little bit more when he gives feedback in terms of the action points. But I think more importantly, which is why Sheila asked me to come up, is that we also realize that the importance of engaging private sector is not just about resource mobilization, but more importantly about how we can elevate and leverage key efficiencies. I think that has been key out of the private sector constituency. We've had a relationship with the Center of Global Health and Diplomacy for close to 5 years through the evolution of the private sector. And a strategic partnership on how we're going to engage, I think, has been a discussion we've really been having on ensuring that we're also leveraging not just efficiencies in the Southern Hemisphere, but how best we can leverage those efficiencies from the Northern Hemisphere. So Joanne Manrique will be able to just give a bit of perspective in terms of how that is panning out. But again, I think today is really about progress, so a lot of work is still in play. I am not a zombie. It's just that I support great people. It's wonderful to have our ministers, and I'm sure the SADC Secretariat can share that. So I'd like to hand over to Joanne, and this is actually my zombie partner. Thank you.
Thank you very much, and thank you for being here. We are honored to be the facilitator to this great initiative. I think there's a lot that will be accomplished with it over the next few years, and we look forward to being here to help you in any way, and helping to, help you achieve your goals. So I'm not going to say much because I think this meeting is really about a working group meeting where you're going to discuss how this comes about. So thank you.
This is my last time coming here. I now have better people who can do it. Yeah, thank you very much. We, in this partnership, one of the real driving forces has been Dr. Brian Brink. As we said, this is just a progress report. The real formal report will be at the Ministers of Health meeting in November, where, one of the things, the 4 things that we had agreed on was we should have at least like a 3-hour meeting with the ministers, just be on the sidelines of that meeting to ensure that we report back, and any new issues that come up, we should, as the partnership, the private sector and the ministers, be able to then come up with and say, okay, next meeting, what do we do? In the meantime, who's supposed to do what? So I think we will be able to do that. But the person now that I want to call is the chair of the SADC private sector, and he'll be the one to tell us, to give us all the 4 things and really call upon people to be able to present. So Dr. Brian Brink, my favorite person, come on in.
Thank you. Thank you, Madam Special Envoy. And Dr. Pariyanatua, thank you very much for convening this meeting, and all the ministers who are with us and all our other honored guests. It's a great privilege for private sector to be working together with all of you here and trying to build better health in the SADC region. At our last meeting at Victoria Falls, which we all remember very clearly, we agreed on a framework with 4 pillars of activity, which we were going to start out on as part of this collaboration between public and private. One of the most important, and I'm going to leave it till last because it's most important, but it was the whole idea of establishing a regional health trust for the financing of health activities in the region. We also talked about the workplace, and we talked about employee health and well-being, but also for companies going beyond the workplace and looking to community and seeing how companies can engage to improve community health. And we coined this term, well, I have to say Discovery coined the term, the 4th bottom line. We're going to talk about that, just give some updates. And Brett is here to do that, and he will be next up, so you can get ready, Brett. And then we also talked about an information exchange portal to improve knowledge and experience sharing between public and private sector. And Shippo, you've got someone to talk to that, and I'm not sure who's going to do it, but you can help. Eric. Right, thanks, Eric. And finally, one of the other pillars and agreement which we reached was that we would create a public-private working group which will meet semi-annually, twice a year, on the sideline of the SADC Ministers of Health meetings to constantly review the progress that we're making in terms of these undertakings which we're getting going. So this really is about reporting back and saying, well, what progress have we made since Victoria Falls? And I hope you will be enthusiastic to hear some of the things that are happening. There's a lot of excitement around this, and Brett, let's start with you. You can take us through the latest on the 4th bottom line.
Thank you. Honourable Ministers, distinguished guests, thank you for taking the time to hear our report back. I've been given a very short time frame, so I'm going to get straight into it. But I'd just like to thank you for your support I think the progress that we've made on this has been exponential, and it's something that the SADC can be really proud of. But, and just to reiterate that fact, is that when we met with the SADC, we realized that employers, private sector and public sector, should take more responsibility for the health of their employees. And we thought that was a good thing. We agreed, and we've moved swiftly ahead. And in fact, we're seeing a change in mindset, specifically around the financial people. Financial people, CFOs, that's what I work as, have seen that not only is it a good thing to do for the health, it actually has a financial impact on the company that you work for. And just recently, not to brag, but Discovery Health received an award from a CFO organization for leading this, for taking the charge and realizing that CFOs should invest in the health of their workforces. But just to give you some, thank you. So just to give you some quick feedback on the progress, since the meeting in Vic Falls, I've been invited all over the show, including all over the world, to present on this. We really hit a nerve, and a good nerve. I was in the US speaking at a large CFO conference for Fortune 500 companies. They loved the concept. And I think the real special event for me, hosted by Dr. Parianyatwa, Jonathan Broomberg, our CEO, and Brian Brink, was a SADC secretarial high-level dinner where we had the public sector and 64 companies from the private sector come and engage. A sold-out event, packed, and incredible support for the idea. We've received significant press, unsolicited press, on how good this is to see the public and private sector collaborating, and how important this is for companies to bring in the fourth bottom line. And for those of you that remember, the fourth bottom line is the fourth line of reporting. So we've got financial, social, and environmental, but companies aren't as such reporting on a dedicated fourth bottom line. The measures, we've made very good progress. We at a point where we're almost ready to release some measures. So far, with help from our Vitality Institute in the US, Discovery, IBM, J&J, Merck, PepsiCo have agreed to pilot with us. So that's a great first step, that we're getting big listed companies that are buying into this. But thank you. But what I'd really like to urge the honourable ministers today is that we really would like the public sector to partner with us and look for somebody within the SADC region in the public sector to partner with us. Because this is a joint venture, we want to do it together. This is for the best of the workforce and for social good. Concerning marketing, we've moved nicely ahead. We've given Professor Slow a book which we are busy moving through, and we're almost there, and we'll be able to get that out. And just something that was hot off the press yesterday, Deloitte in South Africa, who run the best company to work for, which has been a survey that they run within South African companies, and it's very prolific, have agreed that going forward that they will include health measures now to evaluate how companies perform in South Africa. So that's a big step for us, is that major players are seeing the benefit of what the SADC agreed and endorsed, and taking that landmark step, Honourable Minister, to endorse this project, is seeing it rolling ahead nicely. And just something that was shown to me from the American College of Occupational and Environmental Health. There were 4,000 physicians that belong to that. They have proposed now, and I know this is coming, leading from down in Southern Africa, that they introduce in America a health and safety index for companies to report on. And so we know that we're onto something special here in the SADC in the private sector. We're leading it. The world is taking listen. They are listening, they're lifting their ears, and we have a big responsibility to continue driving it. From my side and Discovery's side, we love partnering and supporting you. We'll do whatever we can. We're driving it as hard as we can. We'd love to see the health of South Africa and the SADC region change dramatically. So thank you for your time, and enjoy the rest of your evening.
Thank you very much, Brett. And we're going to keep the pressure on you. We really want to keep this thing going and get real, tangible results. I sit on the board of Discovery, and I said, well, if you're talking about fourth bottom line, I hope that when you report at the end of your financial year, which was in June this year, you will give us some fourth bottom line reporting from your own company. So show the rest of the world how to do it. So you can start the ball rolling right there. Eric, can you tell us a little about the information exchange and the portal? Thank you.
Good evening, distinguished guests, ministers, fellow migrants. I will disappoint the Minister of Zimbabwe because today I will not advocate for the health of migrants, as I always try to do every single time. But as a part of the high-level task force team, IOM was requested to lead the working group, sub-working group, on the creation of the portal, exchange portal of information, taking advantage of the expertise that we have in the private companies. We partner with SAP, the German-based private company and software specialized. So we develop, and unfortunately, this room will not allow us to show you. It will be very abstract, my presentation, but I will just want to highlight that the purpose of this portal was really to organize the information, to have a place, a unique place that private sector, the governments, development partners can put information. We can have this exchange, live connections, and it's pity because also even I was putting some links of the upcoming resolution that will pass on the malaria, and it's three governments from the SADC region are leading that initiative. So it's to say that the portal will give us this opportunity to have in all this latest information. We will not wait to have a twice a year meeting to have this kind of communication between private sector, the public sector and development partners, but it will be a platform that will help us to really have this information. But also one of the things that we were discussing was the share of expertise, the share of the good practices that we have, not only from the public sector, and we have very good initiatives that many of us, we are not fully aware of what governments are doing, but also in the private sector, I think Sheila mentioned from the beginning that it's not about resource mobilization, but it's also what they can bring to the table, and is the expertise, the efficiency, and how they are operating. So I think this will give us also the opportunity to have this information at hand. The other issue is also that in the SADC region, we do have also the expertise and engagement with other partners, including universities, that are supporting some initiatives, like for instance the E8 initiatives. They have also universities who are supporting those areas. So I think it's a great opportunity for us to really have this unique place that we would like for the SADC ministers to own this process. And unfortunately, we cannot present, but we will share with you the links, because we would like to receive the feedback from the government, from the SADC ministers, and if you feel like the information or what we are proposing is what you require for this exchange, I think we need to move forward. As I said, we have already the first draft. Is in a website, but is a draft still. We need to populate, and to populate also, we would like to have the support of the governments to allow us to put some of the information that is key for us in terms of policies, in terms of projects, in terms of all the different interventions that you have. Information is very rich in the region, but what we agree in the meeting in January is that at this stage we will focus on the main three diseases, that is TB, malaria, HIV. But again, the potential is huge, it's enormous, and I think this will really help us to continue to develop. Unfortunately, we don't have colleagues from SAP, but one of the things that we were discussing was in terms of the creation of the website was kind of a not simple exercise, but this is once time off. However, the maintenance of this will require a long-term engagement. And in our conversation with SAP, we agree that this will require at least for the first 5 years an engagement and to support the maintenance of that. Also the information, we like to filter the information, we like to have a committee who will be the editorial team for the information that we would like to see. And since this will be the opportunity for the private sector also to include that information, we will have a series of consultation with private sector also to see what they want to be reflected in the websites. So with the latest technology that we have, also SAP being one of the lead companies, they are trying to develop in a certain way that we will be able to have a great searches features under that, and it will allow us to cross different type of information. We'll also want to showcase the progress that we have. There is an initiative, the E8 scorecard, that is a very good to show the progress. We would like to extend to different diseases, because sometimes if by chance we have access to report like the UNAIDS report or the individual country reports, I think it's something that we need to share. We can move the moon, but if we don't tell to anyone, then no one will notice. So we need to be able to showcase all these good practices. So SAP committed to a 5 years engagement with SADC. They are willing to support on those initiatives. And of course, IOM, we are continued, and we will continue the engagement and supporting from the technical side, and to make sure also that migrants' health is reflected in all these initiatives. So I don't want to take much of your time, so I just want to mention that we will share the link with you. It's just the draft, and we would like to continue the discussion, and hopefully by November we'll be able to have a solid platform that will allow us to continue our conversation online. So thank you very much.
So Chibo, it is not possible to show that. I don't know whether you.
It's not possible. Unfortunately, because of the number of events that are taking place, the hotel wasn't able to support. That's fine. But special envoy, we will be able to provide that link through to the ministers and the officials, so that at least over the course of tomorrow you could look at it on your tablet.
Great.
You're going to do that for everybody here at the meeting.
Yeah.
They all want to see it. So there is something to see, and so that link will be sent around to everybody so they can. It's a beginning. It's early days, but a tremendously powerful medium, and we do want to get the best of what the private sector can pull in to make this a really effective portal, but we'll get it to serve our purpose. So we're looking forward to that. I then want to move on to this most important part of the whole engagement, is the idea of a SADC regional health trust. And this idea is important for a whole number of reasons, but most of all because we want to take ownership in the SADC region of our own health issues and work together to find the solutions which are going to make a better society for us all, and are going to, we know that these investments in health will lead to much greater socio-economic stability and growth for all the countries in the region. So it's a really important investment. It's also really important for sustainability. There's a lot of international financing, there's a lot of assistance that we get from donors around the world. But in the end, we have to also take ownership ourselves to ensure that we make our own investments and deliver results for ourselves. And this concept on its own, I think, is getting a lot of attention because it's what the world wants to see. So it's an exciting time. I do right up front want to acknowledge the big role the Global Fund has played in helping us develop this idea. And I'm not ashamed to say we're borrowing a lot of the ideas that have been used in creating the Global Fund, which is a partnership, and that's exactly what we want to do. The Global Fund's been going for 12 years now. They've learnt a lot, they've made mistakes, they've also done good stuff. And we don't have to go and learn again, we don't have to make the same mistakes. We can take the best of what the Global Fund has done and use that within our own regional context. So, to the Global Fund, thank you very much for all the support that you're giving us in developing this. And apart from all the good ideas that come from them, they're even willing to put some money into this as well. They do want to be sure of one thing. They want to be sure that SADC is in complete support of this initiative. Because, again, the whole point of this, it must be locally owned. And provided they've got that assurance, they're willing to invest some money and help us along. We also want to try and get the private sector to be investing some money in getting this work done around exactly what the trust should look like. But I want to just put forward, we've been thinking about it quite a bit, and some preliminary ideas, based a lot, again, on what the Global Fund has done. But this doesn't have to be too long and time-consuming. It doesn't have to be an agonizing process. There are some things which are relatively straightforward and simple. But these ideas that I'm now putting forward, this is brainstorming. This is just stuff for discussion. This is not to say that anything has been decided. These are just ideas, preliminary ideas. They can be completely changed, they can be thrown out, they can be changed, adopted, whatever. But one thing right up front is we have to have a statement of purpose. Why do we want this trust? What's it going to be there for? And let me just read you one paragraph which would summarize perhaps what that purpose might be. The purpose of the SADC Regional Health Trust is to attract, manage, and disperse additional resources for health through a new public-private civil society partnership that will make a sustainable and significant contribution to reducing the burden of disease in the SADC region, thereby enhancing the well-being and socio-economic development of all the region's people, and progressively realizing the right to health for all. That's just one paragraph. But it's the kind of paragraph which I think inspires and mobilizes people to say, that's what we want to do. How do we get on and get that job done? So that's an example of the statement of purpose. Those who know the Global Fund well and who know the bylaws of the Global Fund will recognize that some of that wording comes straight from those bylaws. But it's adapted. It's adapted for what we want. And that's the important point. So when we model on the Global Fund, we draw from the best of the Global Fund experience. There's a big difference between what we're proposing and the Global Fund. The Global Fund only deals with AIDS, TB, and malaria. Sometimes they find that quite restrictive, and they would like to go further because they know that they cannot have effective programs for AIDS, TB, and malaria in the presence of weak health systems. So some of their investments go towards strengthening the health system, but they always have to have that little rider which says, so that we can better deliver on AIDS, TB, and malaria. We don't have to have that constraint. We can look at health in a much broader perspective, and we know that is where the world is going. So we want to deal with all health issues in the SADC region, but particularly to be looking at those health issues which have regional impact. So we absolutely understand each country has its own autonomy and sovereignty, and they have their own programs and are dealing with their health issues. But we know that all of these health issues are interconnected, and malaria is one of the examples where we will never eliminate malaria in some of the countries if we leave other countries behind. We have to get everybody going forward together. Again, based on Global Fund, this would be a financing instrument and not an implementing body. That's been one of the core principles that the Global Fund has stuck to. I think it's worked well for them. It creates a boundary on the activities, and we're suggesting maybe that we should have that same kind of boundary. This is just about financing. We would work in very close collaboration with all the global health financing entities and all the development partners, and there are many out there. We bring them all in and be part of this collaboration. But particularly we would be looking to increase domestic and regional resources for health. And I'll talk a bit about that, where will the money come from, just a bit later. One of the things we do want to do, though, is to leverage the impact of the international financing. So by ourselves getting involved, we can make whatever international money comes to our assistance in the SADC region, we can make that work many times better simply by our engagement at a regional level. So I think that would be a really important objective. One of the big discussions that will come up early on is all about the governance of this fund. And what we're sort of thinking about at the moment is that this needs to be an independent body. It's a non-profit body. It would be a trust. It would be a partnership. And we're saying public, private, and civil society. Again, we need to debate exactly the terms of that and how it would work. It would have to be hosted somewhere within one of the SADC countries. We've got to find the right place, but hopefully we'd need a secretariat, but hopefully it would be a small secretariat. I remember when the Global Fund first started, and I was there in 2001, they said they were going to be small and efficient and whatever, and they would have no more than 50 people in the secretariat in Geneva. I think at one stage, Mark, you got up to 1,000, did you? Anyway, it was a lot more than 50. It still is a lot more than 50. But there again, we don't have to duplicate any of the things that the Global Fund has got. We can just use some of the stuff that they've developed. So we get a running start at all of this. Of course, this thing would have to be chaired. One of the suggestions, and this is just one idea, but that it should be chaired on a rotational basis between the SADC countries. In fact, as we go with the SADC health thing as it works now, it rotates through the countries, and that would probably be the best way to keep it going forward. But it would be nice in that governance structure, to have a vice chair, which would come from the non-government side. So say from private sector or civil society, so that you always create the balance. And then you've got to have a board. And everybody tries to keep a board small so that you can make quick decisions. It's no more than 8 people. It doesn't really work like that in these kind of multinational institutions, because everybody wants to have their say and everybody wants to be represented. So we need to think that through. How would the board look? For me, it's obvious that every one of the 15 countries in the SADC region would need to have a seat on the board. That's pretty simple. The SADC Secretariat would need to have a seat on the board. That's pretty simple. But we've also got, there are a lot of technical partners, and we know these technical partners well. Just to give you some of them: UNAIDS, Stop TB, RBM, Partnership for Maternal, Neonatal and Child Health, think they're bringing in adolescents there now as well. And I could go on. There are many of these technical partners. They would need to get some seats on the board so that, they can work together with us. WHO. We're all here today because of WHO. WHO needs to be on that board. And then the other UN agencies, all of them, to some extent or another, deal with health issues. So I'm not saying we'd have a seat for every UN agency, it'll get too big, but at least we could, sort of in my thinking, have a seat which would represent UN agencies. And then there are the other funders that are really important. Global Fund, I'd like to see the Global Fund having a seat on this board to be represented. The development banks, African Development Bank, World Bank, but they are, we all know about UNITAID. UNITAID have done a lot of work funding some of the issues which are really important for us. Gavi is another really big funder. So, these funders need to be there so that we work collaboratively together. And then private sector would like to be there. I don't think private sector needs too many seats, quite honestly. I think one seat for the private sector, one seat for the private foundations. That's the way they do it at the Global Fund, and it's worked well. I think that's a good way to go forward. And if we have 2 seats for the private part, then civil society equally should have 2 seats as well. But when you go through all of those, by my calculation, we come to a board of about 30, which is big. But it is manageable, especially if we're all working to a common purpose. The Global Fund often has difficulty with some of the voting arrangements, and that will also be a big discussion. But maybe we just keep it simple and vote by simple majority or something like that, just so that we can get on with the business that needs to be done. We'll need to think about the scope of this regional health trust, and it's around regional health issues, and just a short list: communicable diseases. So we've got the big 3, but there are others which we have to be involved with. Hopefully we're not going to have Ebola down our part of the world, but I think we need to be well aware of and learn from what happened in West Africa so that we don't get caught out the same way. There are all the non-communicable diseases, and we know the price of neglecting those. So they would definitely have to be there. There are areas of work. Maternal, neonatal and child health is a big discussion all the time, and there are indicators in there that we know have to be improved in the SADC region. Adolescent health is really coming up. The importance of that now is becoming well established, and I think if we're looking at some big changes that are going to be happening, we have to engage youth and make sure that we can protect and preserve their health. We don't want 20% of our young people to be HIV positive by the age of 25, particularly women. So, that's stuff that we've got to fix. And that gets down to reproductive health services. And we know, all of cancer of the cervix is a really good example of one of those diseases which has not had the attention it deserves, and it shouldn't be there. If we were to deal with it properly, we could eliminate it. So that's the point, is we can resolve ourselves to say we are going to take the steps necessary to eliminate these diseases, and in so doing, create a much better society. And the last one I want to mention, which is particularly important for us, is migrant and cross-border populations. It's something that requires special attention in our part of the world, and we can do that. We can prioritize that, and we can find money to start doing what we need to do to make sure, to ensure the health of all this migrant and cross-border movement of people does not become detrimental either to their own health or to the health of others. So lots of exciting things that we can do within the scope which we define. That's the beauty of all this. We make the rules. It's lovely. We would have to create some focus in what we do. I think all of us know that we have to strengthen the health system. We have to build capacity. That if we don't do that, nothing's going to work. That's what makes for sustainability. Some of the principles that have been learned from the Global Fund are that you need clear and measurable results. So those are the things that we really want to aim for, but we want to sort of go beyond that, just results. We actually want to show impact. And that's what the Global Fund is working on now. They're doing a lot of work around efficiency and effectiveness, economies of scale. We know one of the biggest issues is around procurement and supply chain for health commodities. We can work together as a region and probably do a whole lot better than we currently do, simply through economies of scale and more efficient systems. We can bring in innovation, and that's where I hope the private sector will be a strong partner, that we can bring ideas that have been successful in business and people who know how to make these things work, that they can bring these ideas into the health arena and start supporting us in the interest of all. We have to make sure that we get value for money. That, if we're going to attract investors, you've got to show those investors that they get a return and a good return on those investments. And finally, where's the money going to come from? So we would like to see the regional governments showing confidence in the structure and showing a willingness to invest in this regional health trust. But we need to get the private sector as well. And I can tell you now, it's going to be tough to get any of these people to make these investments. But we're going to have to work on that. And hopefully we're going to get public and private taking these steps together, that it's not just one and not the other. There are the private foundations as well. And, there's a lot of money in Africa. We need to just harness some of that for health in the absolute certain knowledge that those investments are going to create more wealth. And so we create a virtuous circle by investing in health. There remain still the bilateral donors who are really important in our part of the world, the multilateral donors. And then we've got to look at all the innovative financing. There's lots of talk about innovative financing, but not too much action. Maybe we can start getting some action, because we're not trying to do the whole world. We're just trying to do one piece. And within one region, we can show some of those results. A lot of the innovative financing is about making the money available now, knowing that it has to be paid back later. But if you make it available now and you get the results that you're looking for, those results in themselves will create the return on investment, which enables us to then pay back. So there are interesting ideas that we can look at there around the funding. So this is all work we've got to do and put it forward. And eventually we're going to have grants. And we're going to have to do grant approval and management. And Mark, you know all about grant approval and management. That's the name of your game. And we don't have to do it again. We don't have to learn. We can work alongside Global Fund, who's done this for 150 countries around the world. You've probably learned a bit about how to do it by now and how to do it efficiently and easily. We can build on that experience. We don't have to do it again. Let's not duplicate effort. Let's work together in smart ways. Use the structures that are already exist and are available. Use them for ourselves. And there's one very big important part of what comes out of the Global Fund, and that is what they call regional proposals. And I have to say, up until now, regional proposals in the Global Fund scheme of things have never really got off the ground. There have been one here, one, but the big money has never been in regional proposals. We're hoping to change that. We're hoping to show that regional proposals actually are smart investments, actually probably even better investments than single country proposals. But I want to end this session off by asking Mark if he won't come and tell us a little bit about what's happening with two, at least, big regional proposals with the Global Fund, one around malaria and another around TB. And I was reminded by the SADC Secretariat that there are two other regional proposals, one on HIV/AIDS and one on human rights. And those are actually regional proposals that are currently in progress. But the real new stuff is the regional proposals that have just gone to the Global Fund. So Mark, could you tell us a bit about that? Thank you.
Only a little bit. Thank you, Brian. Honourable Ministers, Special Envoy, Madam Special Envoy, distinguished guests. This is an important event, and I've actually been sick all week and haven't been WHA after an unexpected stay in the emergency ward of a local hospital on Sunday. But I figured there'd be enough doctors here tonight if I keeled over. So honoured to be here. I wasn't quite expecting to talk about regional proposals, but that's okay. We do. Our regional proposals are now. They've gone through the technical review panel of the Global Fund. They've gone through the Grant Approvals Committee, and they are proceeding into grant making. The larger of those proposals is the regional TB and mining proposal. Given the high rates of prevalence of TB amongst miners, this is felt to be a critical initiative. It is unlikely to be funded initially to the level that people had hoped. I think that's okay. I think if it starts off well and it starts off fast, as Brian said, I would hope that within the new strategy period and the new replenishment, there will be additional money to scale those kinds of regional proposals up. The E8 malaria elimination is also, the E8 malaria program is also critical. I think we all realize that given the numbers of migrants in the region, trying to eliminate malaria or trying to stop TB amongst miners without dealing cross-border issues is always going to be impossible. And just to give you a slightly thought-provoking thought, we were discussing the regional artemisinin resistance proposal, program in the Mekong, which is designed to spread, to stop the spread of artemisinin resistance from Asia into Africa. It's a large program. It's about $100 million. I often say that if it works, it'll be the best $100 million. It may be the best $100 million that the Global Fund ever invested, if we can prevent the spread of multi-drug resistance malaria into Africa. And someone said to me the other day, well, maybe in the next period, maybe we shouldn't even have country grants for malaria in that region. Maybe we should just do a regional grant, because that may be the only way that we can deal with artemisinin resistance. So I think there is a future for these kinds of regional proposals. I think what is particularly critical for both of these is that they attract additional money in, additional money from governments, additional money from the private sector. And I think when our technical review panel in particular looked at TB and mining, it said, you know, we really need to see some private sector investment into this issue of TB and mining before we can recommend that the government would really put up the full before we can recommend that the Global Fund would put up the full $60 million that has been asked for. Having said that, the technical review panel also recognized that the entire amount of the proposal, roughly around $100 million, was what they called quality demand. and in the event of money being available, should be funded. So I think that is great credit to the people that helped put together that proposal. If I may, Special Envoy, just take a couple of minutes on the Regional Health Trust Fund as well. Dr. Brink, I think, spoke eloquently and brainstormed about some of the ideas for the content. The Global Fund has agreed to put in $80,000 to work on the process and the mechanism for this Regional Trust Fund. Don't clap too much yet, because there is one condition, and that one condition is that you actually have to ask us for it. So we are still waiting for a letter out of the SADC Secretariat or an expression that is confirmed in writing from the Honourable Ministers that you absolutely want us to do this. I have no fear of signing documents and giving people money. I sign pretty much every grant agreement that the Global Fund puts out. But when Brian said that he thought the Global Fund should only have 50 staff, we actually now have 50 staff in our Office of the Inspector General. So I can't give out $80,000 without some documentation. So I would really ask the representative from the SADC Secretariat to do your absolute best to get us a sort of formal letter confirming that you would like us to do this. And then we can continue with Excelsior, who I think there's general agreement would work to set this up. Excelsior is a consultancy based in Nairobi. They wrote the Kenya HIV/AIDS Sustainable Financing Strategy that was launched in November of 2014 with the Kenya Ministry of Health and the Gates Foundation and the Global Fund. So I think they're quite close. So really, we just need a couple of things. We need the formal request. I think we would like some guidance on a timeline for us to deliver the strategy to the ministers. I imagine that would be the November meeting, Special Envoy, but some confirmation of that would be there. And I think it will be important that we see some private sector contributions to the cost of this, because I think the 80,000 will not be sufficient to cover the entire cost of setting up the Regional Health Trust Fund. And I know that that Brian Brink is particularly focused on that. So I appreciate you inviting me here tonight. I know your time is very short and precious during WHA, and I look forward to making this work together. Thank you.
Isn't that great? Better food for thought than the one that we are getting on the table. So let's give him a hand again. I particularly like the fact, and I really appreciate the fact that he said, actually, he has not been well. I tried to see him before. He's not well. But for this one, he's one of those where it's like nothing would prevent me from being here. So we really appreciate your dedication and your commitment to this cause. And of course, we also value the fact that we will be working with the Global Fund and learn from their expertise. So let's give the presenters a hand. I'm hoping that the honorable ministers can really see that work has been done. They gave us an assignment and we just didn't go and sit on our laurels. We've really been working. There are still snippets here and there that need to be covered, but on that score, I will be able to ask our minister, our chair, to come and open the floor, give his thoughts on what's going on, and open the floor. Because as we said, the trust fund itself, we are going to make sure that each and every step of the way we are with you, with the Secretariat, to ensure that it really becomes a SADC thing. It will have Global Fund, as Brian said, Global Fund aspect, but it will be entirely our own. We can string ideas around, and I know our chair is so available. Let me tell you how available he is. The very first time when the SADC private sector just said, okay, how do we get to ministers? I took my phone. I knew going through the Secretariat might take too long. I picked up the phone and said, can I come and see you tomorrow? And he said, no, we have a Politburo meeting tomorrow, so there's no way I can see you. I said, well, how about Friday? I just need an hour. And when he said yes, I simply phoned Eric Ventura and said, the minister has said yes. So get me a ticket. I'm going to see him tomorrow. And I was there. So that's how flexible and how available he has been. And we really value him for that. So sir, can you give us your ways of wisdom and also open the floor for some questions and, discussion. Yeah. Thank you very much.
Thank you, Special Envoy. Obviously, you've been doing a lot of work, and we are really very thankful to you, and of course to the private sector. But it's been said here that it should be a partnership between government, private sector, and civil society. And I think that should be underlined. And again, people have heard about this initiative. The rest of Africa is saying, well, SADC is just talking. They won't achieve. So we have to not only prove to ourselves, but to prove to the world that things can be done at a regional level in a partnership and successfully. I liked the idea of Mr. Ventura's of the information portal, and this scorecard is now becoming a research-based tool, and I think that should be pushed, and I like the way you have said it with passion. We are concerned that this initiative, I hope that it won't take time to come to fruition. Ministers here are going to approve this. We are going to find a special way. We are here. We've got a quorum for ministers. So whatever we do here, we will be part of that approval. That what is going on, let it hurry. This time it's not hurrying slowly, but let it hurry so that we achieve what we need to achieve. Board representation, whatever it takes, Brian. If it's going to be 30 members and you think that works, then let it be. In the past, board membership has been restricted to 15, between 8 and 15, and it has worked elsewhere. But if you think 30, fine, let it be, and as long as it works. Chairmanship, vice chairmanship, either from the private sector or partnership or co-chairing even. I think that sometimes works even better. So there's continuity. Ministers change each time, each year next year there'll be another minister who will be chairing this. So if there's an overlap with a co-chair, that may give that continuity. So look at that. You looked at the disease burden in the region, and you have tried to prioritize. I'm aware that WHO has got a list of what they've put down for SADC, which you have also looked at, so you may want to share with you that. What are the ministers seeing in their own countries, so that you then look at that jointly, and then you can prioritize maybe better. I like the idea of focusing. We must focus. Often we meet like this in a very passionate way, and thereafter people disperse, and then meet again at another forum. And in between, nothing seems to be done. But in this particular case, although we met far back, something has happened in between. And it is a signal that people are focusing. So that, I hope, should continue. Ideas or measurable results, that's the way to go. You cannot just work and work and work, and you have no impact, and you think you're working, tomorrow you're working. You're putting on a suit and a nice dress and a duke, working. Yeah. So you need to have impact. So we need indicators that indicate what impact we have made. For an example, in malaria, how has it come down? The cross-border initiatives. That should be measurable. That impact should be seen. The number of deaths from malaria should be seen to come down directly as a result of this initiative. among others. And show the value for money. That's what business likes. Not a businessman per se, but I know that. That's why people are sacked, that you are not indeed showing value for our money. So I'm quite convinced that with the private sector's initiative being there, the private sector being there, outside just bringing out the resources of money, they've got a certain expertise and a certain discipline that will help this particular outfit to be a success. Regional proposals, yes, I think, Brian, you're right, and I think Global Fund is correct. Let's demonstrate that, in fact, cross-border initiatives can work effectively. Some of these borders are completely artificial. I've said before that, for an example, in Zimbabwe, you find that at the border between Zimbabwe and Mozambique, the children, the soccer field, one half is in Zimbabwe, the other half is in Mozambique. The cattle, they've got houses in Mozambique and they graze their cattle in Zimbabwe. So these borders are absolutely artificial. So I think that regional initiatives should be seen to be just an initiative for that particular global region. Global Fund, 80,000. And Sheila has said it right. She said, well, very, very good. We love this. This is solid. And I know Sheila, knowing Sheila, she's obviously going to ask for some more, but there it is. I think that that's the sort of thing we want to hear. And it must be, they must take account for it. And indeed, as SADC, if we agreed as chair, as ministers, that we will be able to draft something through our secretariat so that things move fast forward and things get done. As you make your board, you must then make a transparent slot for how money is accountable, so that right from the outset, there isn't any leakage that comes out in the press that is negative. So I think as soon as that money comes, Brian and the outfit, you should really have a mechanism so that we are convinced that our monies, not only are they safe, but again, they are giving the appropriate impact. But as you eat, I can see some of you have finished eating, or are about to finish, or are still chewing. It may be now worthwhile to have feedback, questions, comments, positive, mostly positive, but even some prickly negative. It's all welcome. So any takers? Want to come? Good.
Yeah, let's thank the minister for aptly summarizing. And the promise is made. And of course, he did reveal a secret. You and Mark Daigul are my brothers, so we'll talk again. I don't know why he said so, but we'll talk. So anyway, let me, Brian, are you about to finish eating or you've eaten? But I think while I'm here, when he finishes, he'll come over because he's great in the sense that any questions or comments he'll be able to respond to. So, but in the meantime, I'll be the one to take some comments, questions. Introduce yourself if you haven't already been introduced, and say what you are pledging, or say what you like, or say your question. Yeah. So